last while has been saying, don't do this, don't do that. I think that the impacts of that are certainly showing themselves, and we hope that that will be the case in a serious way going forward. But in my opening comments today, I'd just like to do a few shout-outs to kind of take a different perspective. One of the things that we talked about earlier was that there are three major fundraising commitments that are out there now. People have asked us time and again, how do we help? How can we serve? If we can't be frontline, what can we do? And there were three financial funds that were created. One is the United Way, and they've advised me today that in terms of the relief fund for London area agencies, that currently their local love and global crisis fund has topped over $1 million. And I think that's obviously to the generosity of so many, and we are grateful for that. The second is the London Community Foundation that has a similar fund, and they've been amazing as well. And as of today, they are something over $900,000 in donations. And so while we talk a little about how we're in this together, this is proof that Londoners aren't just talking, they're acting. The third is the London Food Bank. And they had their Business Care Spring Drive. And through that London Care Spring Drive, and through that, they have tripled their the results that they had over this time last year. And it's not to say, by the way, that with those three, that because they're hitting some pretty serious numbers, that we can rest easy on this. This money comes in, but it goes out for the worthy causes that are there, and helping those who are less able to help themselves. And that's why it truly does matter what you're doing. And in that spirit of Londoners supporting Londoners, I'd like to acknowledge Western, who's donated more than 5,000 surgical masks, nearly 1,200 N95 respirators, 100,000 pairs of gloves, as well as head covers, gowns, and other PPE for London hospitals. You know, those were actually collected from 50 research labs at the school. So bravo, Western, and to those three funds that we've talked about, to your support for them, thank you from all our hearts. Warden Burghardt-Jesson, could I turn that to you then?
Well, thank you very much, Mayor Ed. I appreciate what you've passed along and the great things that have been happening in the City of London. I'm going to jump off of that and share a couple of good news stories out in the county then. You know, we don't necessarily have the large foundations and the large groupings that the City of London is fortunate to have, but we do have a very robust and talented group of sewers in the county, and there's quite a group of them, of ladies that have gotten together virtually and have been able to sew masks and head coverings for those working on the front line. And it started out as a very small program, but it has grown, and we've got members right across the county that are providing these products for those that need it on the front line. So that's been exciting. And then there's been a number of community food drives. In the county, there's three different food banks, and each community has kind of set up their own food drives, because there is no question the demand for the use, or the people using food banks during this time, has increased. And so our small communities are out there and have arranged for no contact pickups, and it's been quite exciting to see the response that we've gotten from the community. The one thing that's really struck me in the last week or so, as we enter, I think it's week 6, is how much of a routine many of us have gotten into. But also, I'm concerned with some of the comments that I see on Facebook and different social media platforms about how people are feeling tired, and people are really feeling the effects from a mental health standpoint, and they're feeling very wary of the situation. And you know, the COVID-19 news seems to be very daunting when you turn on the television or the radio. And then, of course, when you couple it with the tragic news from the events in Nova Scotia, this can be very troubling times for people. And I would just want to encourage people to really watch out for their neighbors, their acquaintances, even family members who they may not be with, and reach out to them and try to be a support if they're not fortunate to have a support system that you may have. I know there are great community resources out there to help during this time, and the health unit's a great place to start off to find where to look. But you know, we've shown in many times how we come together, and I'm thinking as this draws on, people's mental health really starts to take its toll. So reach out and get in contact with a neighbor, say hello, and you'd be surprised what a difference that would make. And then I think it's over to you, Dr. Mackie.
Yes, thank you very much, Madam Warden and Mr. Mayor. Those messages of hope are so important right now, and there are so many great things happening right now in our community, people pulling together and supporting each other in creative ways, which is really wonderful to see. In terms of our numbers, provincially and locally, we continue to be fairly flat at relatively high disease rates. Only 11 cases reported in the last 24 hours in Middlesex and London. Provincially, the number was 551, and again, at almost exactly 6% positivity. So quite a bit down in terms of percent positivity from the peak in those numbers about a week or so ago. All very encouraging. We had no new deaths in Middlesex-London. The number remains at 22, and provincially, we saw for the first time in some time, the number of deaths decline, which is quite encouraging there as well. Although, of course, it is every day that we see passing with more deaths accumulating is very unfortunate. The biggest lesson from the last few days is that the work that we are all doing, and that you as the media and the public are doing to respect public health measures, keeping your distance and keeping non-essential businesses closed, is incredibly important, and it is working. That is all very much paying off in spades. The one place where the battle continues is long-term care and retirement homes. These continue to be the drivers of our new case counts, and we continue to work closely with staff and clients and families in those settings. That's it for me, Dan. Happy to take questions.
All right. Thank you very much, Dr. Mackie and Mayor Holder and Warden Burghardt-Jesson. We do have several questions lined up, so we'll get to those right away. And the first one, Dr. Mackie, you were just mentioning the front lines now really being with long-term care. And the first question is for you, and it's from Steve Young at CTV News London. The Ontario Nurses Association has launched court action alleging Henley Place isn't providing frontline staff with adequate PPE during the COVID crisis. We know the health unit is monitoring the situation, and Steve's question is this: are enough safety protocols in place to protect long-term care residents and staff?
Yes, thanks for the question, Steve. And I haven't seen the actual allegations, but I can tell you we have been working closely with Henley Place, as have the leads for the Southwest LHIN. The issues there, primary challenge is around staffing, but as far as we know, all of those issues have been addressed. The question of appropriate PPE, there are now very clear supply chains. Every facility is supposed to do their best to procure their own personal protective equipment, masks, etc. But when they can't, for whatever reason, there is a regional supply, and those facilities will get the equipment they need. Again, I don't have the details of what the allegations are from ONA, but this isn't the first time that we've seen these sorts of concerns come up, whether it's legal issues or complaints to the Ministry of Labor, and those all get investigated and they get resolved. There are definitely protocols in place. There's long-term care and retirement homes are under several directives and protocols from the Ministry of Health, and anytime that those are not being followed, which is unusual, there is every opportunity for long-term care inspectors or public health to issue orders to make sure that they are followed, and that is being done.
All right. Thank you very much, Dr. Mackie. And Steve does have a follow-up question for you. Are enough safety protocols in place in the other long-term care homes in London and Middlesex County?
Yes, I appreciate the question. All of those protocols have been examined closely by Middlesex-London Health Unit. We've done we've done preliminary risk assessment last week, and we're doing more detailed assessments of each long-term care and retirement home this week. And the same protocols are in place across the province. Really, the ministry is very directive at this point. They're very clear what the expectations are in terms of staffing, in terms of personal protective equipment, in terms of levels of care. The flow of patients is a very important part, making sure that anyone new coming in gets tested for coronavirus, even if they don't have symptoms, and then isolating any new admissions for 14 days. That's probably the most important part right now. And then the major change that we had about 2 weeks ago now is that all staff working in those facilities must wear masks at all times. That means that even if they don't have symptoms, even if they're asymptomatic or pre-symptomatic and do have the virus, that they're not able to spread it in the homes. So that was a big welcome change about 2 weeks ago.
All right, thank you very much, Dr. Mackie. And the questions for you, Dr. Mackie, keep coming. Dan Brown at the London Free Press. Another question about long-term care homes and retirement homes. And Dan would like to know, why hasn't the health unit been more fulsome in its outbreak reports with A, listing how many cases are in the named institution, B, how many tests have been conducted in the institution, C, what are the status of those cases? None of the websites for those organizations give any details, and I'm sure families of people in long-term care and retirement homes would like to know.
So of course, families are welcome to gather that information directly from the long-term care homes. You can imagine that in this current environment, we're doing a lot of reporting of a lot of different numbers, and we don't necessarily have time to update every single number every day, given how much work we're doing to actually prevent cases and prevent the spread of infections. There's a huge amount of additional reporting that has never really been requested of public health. And we're having to take staff off of our frontline operations and put them onto gathering data and reporting to various ministries and other authorities. So absolutely, we would love to be able to provide all information to everyone. Our focus is really on doing that when it's going to make a difference to the health of the public. And that's what we are able to do at this point.
All right, thank you very much. And just a reminder also, if you've got questions for Warden Burghardt-Jesson and for Mayor Holder, please send those in. We're going right back to you, Dr. Mackie. Another question from Dan Brown. Windsor, Essex, and Sarnia-Lambton are among the highest in the province for the rate of COVID-19 cases per 100,000 people. Oxford Elgin is among the lowest. In your estimation, what accounts for the regional disparity between COVID-19 case rates in southwestern Ontario?
The main issue between different parts of southwestern Ontario is the amount of cross-border traffic. Windsor and the Sarnia-Lambton area have thousands of staff that are going across the border every day, mostly from Canada to work in the U.S. And you know, as an example, Henry Ford, one of the largest hospitals in the Detroit area, has a third of their nursing staff that are Canadians across the border every day. So the amount of cross-border traffic is enormous, and Detroit is being hit as hard as almost anywhere else in the U.S. right now. Huge, probably about 5 to 10 times as many cases per capita there as in our part of the world. And so when those essential workers are crossing the border, and there's no move or desire to stop essential workers from crossing the border, they are essential. But inevitably, sometimes there are cases of coronavirus that have come back, and that's really what's seeded the outbreak in both the Windsor area and in the Sarnia area.
Thank you very much. And Dan has one last follow-up question for you. Is the Middlesex-London Health Unit coordinating or offering support to public health units in harder hit areas and regions in southwestern Ontario, including the ones we just mentioned, Sarnia-Lambton and the Windsor-Essex, or even Haldimand-Norfolk?
Yes, so the question about are we supporting other health units in the area? Absolutely, we're supporting other health units in the area. We have not been asked to send staff or equipment. We do have mutual aid agreements in place if that is needed, but the health units have not indicated a need for that at this point. But I'm on the phone with the medical officer of health in Windsor on a regular basis. I know our staff work together at the management level and at the frontline staff level, and lots of communications with folks in Sarnia as well. Really, the support that we are offering each other is expertise and advice in different scenarios that are coming up very quickly, and we're all having to react to together. So there's a lot of collegiality and partnership at the leadership level, and lots of logistical work together. You know, you can imagine that we have lots of people who live here, work there, or vice versa, and have to coordinate on cases like this fairly often.
All right, thank you very much. Dr. Mackie, another question for you from Sophia Rodriguez at CBC London. Sophia's question is this: London Health Sciences Centre has a policy in place that has out-of-town cancer patients rooming with strangers in hotel rooms and sharing bathrooms and kitchenettes while they receive treatment in the city. What do you think of this policy? Is this the right approach considering the physical distancing rules that have been set in place? Shouldn't there be tighter restrictions considering these patients have compromised immune systems?
Well, Sophia, we have heard those rumors as well of people sharing hotel rooms. At this point, London Health Sciences Centre has not been able to confirm those. They have indicated to us that that is not the case. It's not their policy and it's not happening. So not sure what the reality is, but you probably need to work with LHSC to get more information on that question.
Great, thank you very much. And again, we're about 12 minutes left in the briefing. If you've got questions for Mayor Holder or Warden Burghardt-Jesson, by all means, get those in. I know we've got some folks from county media who are tuned in, so we'd love to hear from you this afternoon. Dr. Mackie, we're going to go right back. This is a question from Sawyer Bogdan at AM 980 CFPL Global News Radio. I know tracking cases in shelters was touched on yesterday, but when people are hospitalized and are homeless and have not gone through the shelter system, is that something that is being tracked? If so, do we know what those numbers are?
Sure thing. Happy to address that, and then also probably speak to another stat, which is about the cases in the county, which we've been able to pull together, and I actually just sent over to the warden before we spoke on this call. The question about are we counting homeless people who are hospitalized but haven't come through shelter? Very difficult stat to identify. There's actually a research protocol that's being developed by our local research community, and the health unit is partnering on to try and identify people who are homeless from administrative data sets that don't necessarily ask, are you homeless? So that is something that is really kind of in the research realm and not something that can easily be pulled out of this sort of information. That said, if we had somebody who was homeless and we were doing contact follow-up, as long as the person was not, unconscious in an intensive care unit, if they were in a general ward, we would be able to work with them and inquire about their living circumstances. At this point, I'm not aware of anyone who is homeless who hasn't come through the shelter system. We did yesterday mention the one case and the person who was homeless but had not been in the shelters while sick. So fortunately, we haven't had any positive individuals who have come directly from shelter. In terms of the numbers for Middlesex County, fortunately not a significant increase from last week's numbers. The Strathroy-Caradoc count of cases is 15 cases. That's about 4.5% of what we have in the Middlesex and London region. 6 in Middlesex Centre, that's up from 5 last week. 1.8% of our total cases in the Middlesex-London region. And the total of 3 deaths now in the county, which is up from 1 last week. Which is about 13.6%, or right around the population percentage that you would expect in terms of that death rate. So fortunately, not huge growth in cases or fatalities in the county over the last week.
Thank you very much, Dr. Mackie. All right, just going into the questions. We've got some more, so I'm just scrolling down. it's funny, we're still getting used to the software. You're in there and then you're not. All right. A question now for the warden. This is from Grant Demi at MyFM Radio in Strathroy. And the question is this: do we know how many COVID-19 tests have been issued in the county to date?
Well, thanks for that question, Dan. But I do think probably Dr. Mackie might have those stats better than I can. I'm just looking over the email that he sent me earlier with the numbers, and I don't believe that it breaks down the actual tests that have been given to county residents. I do know that that was a topic of discussion early on during this about, the possibility of bringing a testing site out to the county because, of course, the interim or the testing sites that were set up were just set up in the city. But I don't believe that the numbers have warranted setting up a separate testing site. I think had we seen different numbers, that might have been a different discussion that we would be having. But perhaps maybe Dr. Mackie has some actual numbers or statistics with regards to exactly how many tests have been issued to county residents.
Yeah, at this point, Madam Warden, we don't have the distinction between whether the tests are done in the county or in the city. And in fact, the hospitals here are doing testing for the entire region. So unable to pull out which ones are Middlesex, unfortunately.
Okay, thank you very much. Another question for the warden, this one coming from Dan Brown at the Free Press. Wondering if there have been any fines issued in the county. I know that OPP is handling that, and that the last time you were able to join us for the briefing, there hadn't been any. Has that changed? Have you heard of any?
I believe that there was one charge that was laid last weekend, about 8 days ago. But since then, there have not been any further charges. As I have said on numerous occasions, the approach that the municipalities are taking is an education approach, and we are doing that in partnership with the OPP. And only the OPP are only going to be laying a charge should there be blatant disregard for standards and that have been set out. I know at the Lucan Biddulph level, we have increased the amount of patrolling that our bylaw officers are doing around parks and areas that people would normally just congregate. And I believe that that is what's happening right across the county. And it's just education.
All right. Thank you very much, Warden Burghardt-Jesson. Another question from Steve Young at CTV News for Dr. Mackie. Dr. Mackie, you mentioned yesterday that an inspector was assigned to see if there was overcrowding on LTC buses in London. Wondering if there's anything new to report.
Yes, so thanks for the question about the London Transit Commission buses. We did inspect several of the buses yesterday. In general, we found there was no issue maintaining safe distancing within those buses. There was an example in one of the downtown buses where there had been some fairly crowded conditions. And so at this point, we're working with LTC management to identify the best possible remedies to make sure that we can try and support safe distancing within the buses.
Thank you very much. All right, we have one more question, and it's one for each of you, and I think this is probably going to take us right till the end of the briefing. So the question for each of you, and Mayor Holder, we'll start with you, and then we'll go to the warden, and finally to Dr. Mackie. It has been, and I'm just reading this, and it seems a lot longer. It's been a month and a day since the city declared a state of emergency. What do you say to the people who are feeling a bit under the weather about what life looks like at the current moment? Mayor Holder.
Well, it's been a month and a day since we declared the emergency, but it's been longer than that since we've been dealing with the pandemic. And a strong shout out to the Middlesex-London Health Unit for its leadership that way. I think that's important, but also to my own administration and council for the work that they have done in putting the pieces in place that matter to Londoners. So, as much as it's been that amount of time, and we've been very consistent, even with the better numbers that at least today have brought that Dr. Mackie's brought forward, and that is to be vigilant, to remain vigilant. We're too hard to be at a stage where we let all the great efforts that people have put in place to let those go. We just finished a number of religious celebrations, and we asked people to attend virtually, and people have been great. We've certainly had a number of bylaw enforcement issues greater than Middlesex County, but even that number, excuse me, has dissipated as people, pardon me, as this whole issue of education has come in. And so kudos to Londoners. We know the weather, notwithstanding today, is going to get better. We're asking people to keep an eye on their kids, keep an eye on that whole issue around self-distancing, be safe. For the love of each other, of your family, we ask you to do that. So the messaging has not changed. The concerns we have not changed, but I think the results are starting to, and that's because of the strong efforts of Londoners, and I say bravo, and please keep it up.
Madam Warden.
Okay, thank you for that. I would almost go back to what I started the briefing off earlier by saying, it has been a long 6 weeks. We declared an emergency in the county the same day the province did. And, it has seemed in some respect much longer than 6 weeks. But to echo what Mayor Ed said, the hard work is paying off, and it's not time to take our foot off the gas pedal. So we are seeing the results of adhering to physical distancing, to the isolation, to making choices in the lifestyle that we have to lead now. But I would also say that there's opportunity in the way that, we've had to adapt to the environment around us. And it's all not for the bad. I think when I talk to my residents, I do say, out of crisis comes opportunity, and look for the positives. Yes, the weather out today might, say otherwise, but we are entering a better time to be outside in our yards, to take advantage of that. And as long as we keep our foot on the gas pedal, we will be out of this, I have no doubt. And as Ed said, the messaging doesn't change. Self-isolate, quarantine, use technology where possible, and make appropriate choices. And we'll be out of this before we know it.
Thank you very much. Dr. Mackie.
Well, I think what our society has been able to do is nothing short of miraculous. I mean, how many people thought that they would be part of, fighting a pandemic and be successful in doing so? That's really an accomplishment, and something every single one of us should be proud of. It's also been an opportunity, and maybe for those who haven't taken the time, there's still an opportunity to really consider what matters to you in your life, to figure out what your priorities are, and figure out how to try to redesign your life to center on them. I know many of our staff have had the opportunity to work from home. Well, actually, just about all of our staff have been able to work from home at the Middlesex-London Health Unit. And that can really change your perspective on things too. It can be an improvement in quality of life with less commuting and parking costs, that sort of thing. And also it can mean that you're able to spend that additional commuting time with your family and or doing the things you love. So that's a great opportunity. I think anytime we have the opportunity to stop and think about our lives in a really deep way, that's got real potential benefits.
All right. Thank you very much, Dr. Mackie, Warden Burghardt-Jesson, and Mayor Holder. Well, we're just about a minute over time, and the half hour, as it always does, flies by. Thank you very much, Mr. Mayor, Madam Warden, Dr. Mackie, for being part of this again today. And thank you for tuning in and for listening. And we'll see you all again tomorrow afternoon at 2. Have a great rest of the day.